Hi everyone, thank you for joining our virtual dental shadower session. We want to remind you that in order to get your hours, you will have to take a short quiz, and as long as you get a 3 out of 5, you will earn your hours. The quiz link will be located in our link tree, which is in our Instagram bio. All right, so let's get started. We're very fortunate to have Dr. Jayapriya for today's session. I'm handing the mic over to you now. Feel free to start whenever you want.
Right. Hi, guys. I hope I'm audible and visible. So before I start, I want to congratulate everyone behind Virtual Dental Shadowers for actually creating this platform of continuous learning, especially during unprecedented times. I know for a fact that in my time, I couldn't shadow someone who was abroad. And in my time as well, I had no idea what forensic odontology is. So this is such a great platform for students to learn, as well as for professionals to spread that kind of awareness to future dentists. So congratulations and keep the work up, yeah. So I am Dr. Jayakumar. I'm a forensic odontologist or forensic dentist practicing in the UK. A little about myself, from India, from South India to be specific. But I was born and raised in Muscat and Dubai, here and there. So I did all of my schooling there. I did my VDS, so that's my did my 1 year internship, the compulsory internship that we have to do in India as well. But it was through college that I had the opportunity to do a studentship in France. It was in a university called Paul Sabatier. It's in southern France in a city called Toulouse, which was an eye-opening experience for me. It sort of taught me how dentistry and practicing dentistry, even dental education, was different across borders from one continent to another. After which I did my specialization in forensic odontology in University of Dundee in Scotland, UK. I also later did my diploma in forensic archaeology and anthropology in UK. Hoping to start my PhD soon. My current work profile is, so I'm a forensic consultant for an organization called Kenyan International Emergency Services. So what we do is something called as DVI, which is Disaster Victim Identification. So the organization sort of sends forensic pathologists, radiologists, or dentists to a place where a disaster has happened. Everything from tsunamis, fires, earthquakes, even airplane crashes. And will be recruited to that particular location to identify people, identify victims that cannot be identified otherwise. So I know that there is a branch in the US as well, but they also have an office in the UK. I'm also a keynote speaker and organizing member for a lot of international conferences, webinars in the UK, Europe, US, Middle East, and Asia. I'm an editorial board member for a journal back in India. I'm also a member of British Organization for Forensic Odontology, British Association for Human Identification, Chartered Society of Forensic Sciences. And very recently, I've been appointed as the UK coordinator of Worldwide Association of Women Forensic Experts. Now, my latest research work and publication is the role of charting dental anomalies in human identification. And this is going to be like a major chunk of what we're going to be discussing today as well. About choosing specialties, so why forensics or why forensic dentistry is purely out of interest and a lot of interest. And who isn't interested in Sherlock Holmes or a crime-based documentary on a serial killer? I know Netflix was crawling with it for the past few months. So it was definitely based on interest. I had a lot of interest in research and forensics and within dentistry. I know it's a niche subject, but it was definitely something that I'm passionate about. But when I graduated my undergrad dental degree in India, I had no idea about how I'm going to pursue this because very few universities around the world actually offer a really good master's program for forensic odontology. So I had to do my research and look into universities worldwide, dental school rankings, even scholarships, so that I can afford to do a PhD abroad. And to my surprise, forensic odontology was taught only in 3 countries at the time. So it was Belgium, Australia, and the UK. I did not opt for Belgium because of the language issue, because I wasn't really on plan with learning a whole new language before I started doing my master's. So again, it came down to Australia and UK. And while comparing Australia and UK, I observed that the UK had a lot of scholarships, academic scholarships. The rankings were great. Their program was even better than the one in Australia. There's a lot of student support, especially for international students in the UK as well. So that's how I chose UK for my place of study. Now, why University of Dundee amongst all other universities in the UK? Definitely the dental school rankings. When I joined University of Dundee, so it was in 2019, University of Dundee, the dental school of the University of Dundee was ranked #1 in the UK. Always been in the top 5 in UK. Similarly, the forensic school rankings as well, they've always been in the top 5, and the year I joined it was again top ranked #1 in 2019 as well. So even in the UK, the University of Dundee is known for its dental school and its forensic school as well. Then, of course, the unique master's course, when I was actually researching about it, is because in dentistry, we don't really deal with death, and there is no forensics, unlike our similar medical degree. So transitioning from dentistry, where you only treat live patients, and then you jump into forensic odontology, where you deal with human remains and death, is a huge step. So we really need that strong foundation on which you're going to build your forensic odontology knowledge. So it was quite surprising to find that although it's a forensic odontology course, they had forensic science, a forensic medicine module, forensic archaeology, forensic anthropology module, even forensic law, so criminal law, so that we are trained to go as expert witness in courts and how to talk to a judge and a lawyer and all of that. So it was a complete package of forensics, although it was a forensic odontology course. And of course, the staff is super supportive. There were scholarships that was funding my master's as well. Also the hands-on experience, the practical experience. We had autopsies that we could learn on as a student. And also the course was very feedback-based. It was very tailor-cut to the students' needs. So that was one of the major reasons. The course itself was very interesting as a forensic odontologist. And of course, the student support. The University of Dundee was awarded University of the Year for Student Experience years now. And one of the reasons for that is they have so many societies that you can join, so many events taking place. And this is, of course, before Corona. And so, yeah, there was even mental health support systems for students from anywhere around the world. Of course, the city itself, Dundee is a very calm and beautiful city compared to busy Edinburgh or Glasgow. It's definitely beautiful as well, as you can see in the picture. But also for the fact that as an international student and also as a person of color, it is important that you go to a crowd or you go to a community that welcomes you. And I've been here for 3 to 4 years now, and I can say for a fact that Dundonian people are very warm and welcoming. So yeah, these are some of the reasons why I chose University of Dundee as my choice when I decided to take forensic odontology as my specialization. Now, advice for future dentists. So I'm going to divide this into the ones that are interested in forensic odontology and the ones who are just curious about forensic odontology, but they're not really interested in taking it up as their specialization. So for the ones who are interested in forensic odontology, the one thing that I want to tell you is if you're really passionate about research and if you're really passionate about the subject, earning a really good income is a factor when it comes to being a dentist and even being a doctor. But if you're passionate about something, it's definitely worth it. And even the struggles are really rewarding in the end. So definitely focus on your interests. Go for something that you're really passionate about. And this is not just for forensic odontology, for any specialty that you want to go for. But saying that, I should also warn you about research and its struggles. Now, I know dentistry is a field that needs a lot of discipline and patience, but when it comes to research, it needs way more patience, way more discipline. There's a lot of reading, there's a lot of academic writing. And when you start doing your PhD, you're going to definitely have issues with funding and other financial struggles. Even finding a full-time job in the research field is going to be a struggle in the beginning. But it's all rewarding when you know that you're shaping the future of dentistry. So you're going to create something with your results that other dentists or other dental students in the future are going to adapt into their practice. So you're basically leaving a mark in dental history. And that, for me, at least personally, is such a joyous thing. So it's definitely rewarding, although I should warn you about the struggles. Another advice would be reach out to other forensic dentists. Now, I don't have to tell you this. You can reach out to anyone these days using LinkedIn, social media, other social media platforms, like Instagram, Facebook, any of that. But the difference between reaching out to a dentist with a lot of followers and reaching out to a forensic dentist, the difference is that as general dentists, you can post your cases, you can post stuff and, definitely fun stuff about your work life and about stereotypes and stuff like that. You can even do TikTok dances in your Instagram reels. But being a forensic dentist, you can't have that kind of content creation because your content is basically human remains and death and decay and, to be honest, maggots and all of that. One thing, this kind of content can trigger someone. That is one thing. The second thing is a lot of social media guidelines and regulations don't allow you to post that kind of stuff. So even if you know a forensic dentist and you don't see a professional Instagram page or you don't see even a private account that posts about their work, it doesn't matter. You can still reach out to them. And a proper example would be me. So I don't have a professional Instagram account where I post about my work because I can't. But even then, if someone reaches out to me asking about forensic dentistry or about how I went through, how I selected my uni and all of that, I'm more than happy to help and guide anyone. So it's the same thing with other forensic dentists as well. So reach out to other forensic dentists and learn about their experiences, pros and cons about being a forensic dentist and all of that. I'm sure they're ready to help you anytime. Now, coming to maybe like the cons of being a forensic dentist, or something that is not a lot, like talked about a lot about being a forensic dentist, is dealing with death and decomposition. Now, the problem with, not a problem, but because as dental students, I know for a fact the UK dental undergrad dental degree and the Indian undergrad dental degree, we don't have anything that prepares us to deal with death. Because we have, again, as I said before, we deal with live patients coming in and live patients going out. So we're not prepared to handle death or anything forensic related. So jumping from being a dentist, treating only live patients, of course, and suddenly transitioning to a specialty where there is just death and decay and human remains, and there's other assault, and it's a lot of negative, of course, negative issues. So dealing with that is definitely one of the struggles of being a forensic dentist. It's not impossible, but the thing is, a lot of students, or I've seen a lot of students getting into forensic odontology thinking it's only research and it's going to be fine. But halfway through the course, they can see that this is taking a toll on them and they drop out. So if anyone is interested in forensic odontology, please do your research, read more, understand what you're going to be doing as a forensic odontologist before joining a course anywhere around the world. And coming to the last point, it's mental health. So there's a stereotype with forensic practitioners, clinicians, that most of them have some history of substance abuse. One of the reasons of this is they fail to sort of disconnect work with their personal lives. So because you're surrounded with the idea of death and assault and bite marks and all of that through like 8 hours of your life, and then you come back home and you come back to your family, if you fail to disconnect from that sort of negativity, it will definitely, or at least I know with a lot of colleagues that I know, it will have an impact on your personal life. So learning how to disconnect from work is definitely a huge thing when it comes to forensic odontology. And although there have been cases of a lot of forensic practitioners having the history of substance abuse, it is not impossible. And a very personal example would be me. I was diagnosed with anxiety when I was in my dental school, so my undergrad dental degree. And I was actually quite concerned if taking forensic odontology will be good for my mental health. But learning how to separate your work life and your personal life is definitely going to play an important role. It's not impossible, and I don't want to sound scary, but it is definitely doable. So this is something that is not quite talked about, and I want to sort of shine some light upon. So this is for the ones who are interested in forensic odontology. For the ones who are not interested in forensic odontology and you're just curious about the subject, there are so many ways you can support your fellow forensic odontologists in your country or even abroad, and even the Interpol themselves. Your dental records are going to help in identifying someone in the future. It's going to help indirectly or directly in a forensic odontologist's work. And we're going to be talking about this in the research part of the session today. And before I go to the research part of the session, my presentation is definitely going to contain triggering and sensitive material. I've tried my best not to put a lot of gruesome pictures, but sometimes to let you know or give you a clear picture of what we do, it is important to see what you're getting yourself into. So there's definitely going to be mentioning of death, decomposition, human remains, sexual violence, rape, sexual assault, and abuse. But if you feel triggered at any point of time, please feel free to take a break and then come a few moments later. Another request that I have is please don't take screenshots or photos of the cases that are discussed here. It's not like a clinical case that you would see in a dental clinic, a dental practice. These are autopsy cases, and I really hope you guys don't share it anywhere because, as I said, one thing, it would trigger someone that you know, someone who's following you. Another thing is, because you don't comply with the guidelines, your account might get deleted by Instagram or Facebook or whatever social media you're using. So please be careful. So yeah, we'll move on to forensic odontology in depth. First, I'm going to introduce what forensic odontology is. Forensic odontology is basically, by definition, by the Federation, now, why we need forensic odontology. So in forensics, it's determined that, so identifying someone is basically determining his or her or their individuality. Now, back in the day, primary identifiers were considered to be DNA and fingerprints. Now, the problem with DNA is it comes to fingerprints, fires in cases like extensive trauma or decay and a lot of cases where teeth comes into existence. So teeth not only provides individuality, durable, and they're highly resistant damage. Also one of the reasons why they're the easiest, reliable, and economical methods of identification, because I'm sure you would know, while taking DNA or taking fingerprints, it's quite time consuming, it's complicated, it's expensive because you use these complicated softwares to analyze them and all of the database as well while you're tackling identification. But teeth, forensic odontology for that matter, really strong dental records, really up-to-date, accurate dental records. It's probably, as mentioned before, the easiest, most reliable, economical method of identification. Now, what does a forensic odontologist? A major chunk of our work, or major chunk of any forensic odontologist's work, is human identification. So that's basically dental autopsy. So it's basically identifying someone. It is also going to be a major part of our session today. Something else that we do is age estimation. So you do age estimation for children, adults, adolescents, and we have different ways of doing it. There's a visual method, radiographic method, biochemical method. It's quite complex, but it's a very interesting part of forensic odontology. Another part of forensic odontology is definitely bite marks. Bite marks is, again, a very interesting part of forensic odontology, but it's also a very sensitive part of forensic odontology, especially because I know a lot of forensic odontologists opt out of analyzing bite marks because of the risk factor involved in the field. And the reason for this is in the past, especially in the US, there have been a lot of wrong convictions based on bite marks. And the reasons for this is a whole other lecture, so we're not going to get into it, but it definitely did tarnish the name of forensic odontology, definitely in the US, but also across the world. But yes, bite marks is also one of the things that forensic odontologists are actually qualified to do. Another aspect, and as I mentioned before, is DVI, disaster victim identification. This is, again, a very strenuous part of being a forensic odontologist. So as I said, say a disaster happens in a particular country, you will be recruited there for probably a few days, probably 15 days, probably a month. It definitely depends on how bad the disaster is and how many victims are there to identify. So it depends on that. But to be away from your family in a country that you don't know for days together, dealing with just death around you, is definitely strenuous, and it can take a toll on your mental health as well. But again, there's a lot of support systems for you once you get back home after your experience as well. So that is DVI. That is also something that we do. Another part, a very corporate or legal aspect of forensic odontology, is identification of medical and this comes usually in insurance when it comes to getting dental insurance or medical insurance. So you basically identify if a treatment was necessary or not for the patient, or if it was done for benefits, personal benefits of the dentist, which is mostly financial benefits. So again, this is something that we do. Then, of course, there is the research and teaching aspect of forensic dentistry, just like any other specialty. Another thing that we do is going as an expert witness in court. So you basically submit your evidence to court as an expert witness. And these cases can vary anything from rape, sexual assault, abuse, domestic abuse, child abuse, age estimation, and even human identification. So it can be any of those cases. So that's what we do in a nutshell. So next session is
Sorry for interrupting, Dr. Jayakumar, but your audio keeps cutting out. Would it be possible to mute and unmute yourself to see if that will help?
Oh yeah, sure. 1 second.
Yeah, it is still a little difficult to hear, but it should be okay now that you have tried it. It just like cuts out in the middle.
Oh, I'm so sorry.
That's all right. Yeah, it should be okay now. Like I can hear you as of right now.
Okay, that's great. Okay, so moving on to the next session, next part of the session is some famous cases in forensic odontology from all over the world. So the first ever documented case of forensic odontology happened in the Roman Empire. This was when the Emperor Claudius, his second wife, ordered her soldiers to kill his first wife, Lolia Paulina. And after the soldiers, of course, severed her head and brought it back to Agrippina, Agrippina was satisfied by the death of Lolia Paulina after she identified using her dental alignment and certain distinctive characteristics of her dentition. So this was the first ever recorded use of forensic odontology in history that we know of till now. Another famous case is of Adolf Hitler. So we would know that after the World War II, Adolf Hitler and his wife committed suicide. The Russian forces did get his remains, but their autopsies were quite inconclusive. But it was years later that Hitler's dentist identified the remains as of and confirmed his identity using a 9-unit on the slide. Another famous case, especially in the US, is of Ted Bundy, Theodore Bundy, who was an American serial killer, was responsible for more than 30 women's rape and murder. But amongst his victims, Lisa Levy is attacked by Ted Bundy and bitten as well, but she got to get away. After his arrest, Ted Bundy was forced to submit a dental examination, as you can see, and it confirmed that the bite marks on Lisa Levy's body was definitely Ted Bundy's. And this was the first recorded time in Florida's history where a case depended on bite marks as one of the primary evidence. See more about this in Netflix in Conversations with a Killer, the Ted Bundy tapes. There's also a movie about Ted Bundy where Zac Efron plays Ted Bundy as well, called Extremely Wicked, Shockingly Evil and Wild. So that's a few cases. From a DVI perspective, two of the very famous disasters that used forensic odontology was the World Trade Center disaster. In 2001, at least 501 victims were identified during the World Trade Center disaster using dental comparison, using forensic odontology. Similarly, during the tsunami in Australia, a major portion of, that is 87% of identifications were done using forensic odontology as well. And exactly the same thing happened in Thailand as well. 70% of the victims in Thailand were also identified using dental information. These are two of the famous disasters that used forensic odontology from a DVI perspective. Now, going into dental autopsy. So this is normally what you would do as a forensic odontologist. So this would answer the question of what your typical day would look like. So it starts with definitely initial preparation. So you prep as in you go for a surgery. You wear all of your PPE, boots, the suits, the head cap, everything that you would go in for a surgery with. It's preferable that two forensic dentists do the autopsy, and you assign between yourself and the person to become the dirty dentist and the clean dentist. Dirty dentist is, of course, the person who's going to get their hands dirty. The clean dentist is the one who's going to write the findings that the dirty dentist is going to direct to them. And we have two forms, so that there's the ante-mortem form and a post-mortem form. The AM form is the yellow form, as you can see in the picture, and the PM form is the pink form. And during the autopsy, we're going to only use the pink form. So after the initial prep, we have dental and oral preparation. So this is basically gaining access to the oral cavity. In most of the cases, you'll be able to pry the mouth open because the rigor mortis wouldn't have set in. But otherwise, you can also use retractors to get to the mouth opening as well. But in some cases, such as extensive fires or major trauma or even very strong rigor mortis, you can't pry and open the mouth enough for you to get accessibility or visibility. This is when you do an incision. And the incision is mainly from the angle of the mouth to the tragus at either side of the ear, and then you stitch it up as well. But what I need to mention is this should be the last measure when it comes to gaining access to the oral cavity, because it's definitely on the facial area. This is done as a last measure only if you don't get any sort of accessibility to do a dental autopsy as a whole. After you get access, it's definitely cleaning the oral cavity. As I said, you never know where the body is coming from. It could be from a marsh, it could be from the river, it could be from anywhere. So there could be a lot of dirt, there could be maggots crawling out, there could be worms. So it is essential that you clean and get absolute visibility to the dental structure that you're examining. The oral prep is your PM recording. So that's the postmortem recording. And the first quadrant to would check in a patient. And then there is radiographs, but here your radiographs are going to be portable radiographs. So most of the mortuaries or even a few forensic odontologists have portable X-ray machines that will take radiographs, and mainly your radiographs are going to be periapicals and bite wings. After radiographs, there is definitely, you need photographs as well. Most of the time, your autopsy is going to be on a full body, but sometimes you might even get fragments. So it could be a mandible, part of a mandible, a skull, could be a tooth, maybe a few teeth. And if that's the case, there is something called as the ABFO scale. So that's the American Board of Forensic Odontology scale. You use the scale and take the photograph as well. But if it's a full body, it's usually exactly how you would take a patient's photograph. So it's anterior right buccal, left buccal, maxillary occlusal, and mandibular occlusal. So after recording the dental data, and that is the charting, radiographs, and photographs, you start with your AM data collection. So at least I know in the UK, the AM data is not collected by dentists and usually done by the police. Now, your AM data or antemortem data constitutes anything that can give you info about someone's records, x-rays, photos, charts. It can even be appliances, study models, and casts. Anything that gives any kind of information about someone's oral cavity is AM data. Now, as I said, it's mostly collected by the police based on the missing persons report, but it's given to us for further examination. And this is one of the reasons why this session is not only important for dentists, but it's also important for police officers so that they know what is to be collected as AM data. And this is also one of the reasons why my session and my atlas that I've created has also been shared with the Scottish Police. Now, once you have your AM and your PM data, you start your comparison. So your PM data will be in the pink form, as I mentioned before, and your AM data is definitely, for example, let's take this clinical chart from a dental practice, and you will put it onto an AM form because you might get clinical records from so many years behind. So you need to check and look the latest treatment and the latest finding that has been yellow form, and then you start doing your comparison. One of the reasons why you do PM and the AM is because there's always a bias when you have the AM record with you. You tend to sort of try and match findings subconsciously into giving a positive identification. So this is one of the reasons why you do PM first, and then you do your AM, and then you do the comparison of the both. Now, after your comparative analysis, you conclude with 4 basic conclusions. One is positive identification. So you're basically saying, okay, this is Mr. X. Your possible identification is this may be Mr. X, but there are inconsistencies. Insufficient evidence is you do not have enough AM data to come to a conclusion that this is Mr. X. Exclusion is no, this is not Mr. X. So this is basically your 4 different conclusions after your comparison. Now, once you come to a conclusion, the very important part of your whole autopsy procedure is even if you do your autopsy in 2020, it could be probably after 20 years that a case comes up and the court might ask for your report done in 2020. So it's very important that your report contains everything and anything that you did during an autopsy. So your report starts with the case number, of course, and then you also need to mention about your qualifications to do an autopsy. So this is a report from when I did as a student. It was an exercise. I can't share actual reports from the mortuary. It's illegal. So your report basically consists of the case number, your qualifications, chronology of events. So who called you? When did you come to the morgue? When did you start your autopsy? What are the tools you used? What are your conclusions? What are your summary of findings? So all this includes in the first page of the report, and definitely your conclusion as well. So if it's a positive identification, if it's an exclusion, all that goes in the first page of the report. The next few pages of the report is basically your proof, your evidence of your conclusion. So it can for comparative analysis, your dental charts that you used, of course, radiographs and photographs, and also the glossary. Why a glossary is important is because, so your autopsy report is not only going to be handled by dentists. Go to a police officer, it's going to go to a lawyer, it's going to go to a judge. So they're not going to understand what occlusal surface is, or they're not going to understand what mesial occlusal is, or buccal is, or lingual is. So this is one of the reasons why you need to put a glossary in your report so that even a lay person can understand what you're talking about or what you're describing. And as I said, there needs to be radiographs, inferences of the radiographs, photographs, and its description as well. And that is your whole report. And that is the whole autopsy process. This is your typical day. Now, coming to the research aspect of forensic odontology, and this is for, as I said, who's interested in forensic odontology as well as who's not. Now, in a very, so from forensic odontology perspective, at least from identification, human identification, foundation of this sort of identification is that every individual has a unique dentition. Now, this uniqueness can come from or crowding. It could be any of your dental features, or it could be even dental anomalies, rotation, additional cusps, anything of that sort. So any of those features or anomalies gives your dentition that kind of uniqueness. Now, my research study was based on, so I wanted to evaluate the awareness regarding forensic value of recording dental anomalies. And my study group was in India because it was easier for me to collect data from my sample from India. And I it was basically evaluating awareness and also maintenance of dental records as well in South India. Now, my methodology was, so it was an online survey-based study, and it had 4 sections. The first section was information on the participants' background. So it was years of experience, the state in which they were practicing. The second section was a dental charting task, which I'm going to be talking about in the next slide in more detail. The third section is questions on the of charting dental anomalies and recording anomalies irrespective of patient's chief complaint. The second was based on maintenance of these dental records and also basic awareness on forensic odontology as a whole. Now, coming to the second section, so it was basically a dental charting task, and I gave them a Photoshop image of quite a few dental anomalies, as you can see. And I gave them 24 options to choose from for each tooth, and I also gave them additional space for them to write findings such as stains, calculus, attrition, etc. Now, after the dental charting task, I should say the results were quite disappointing but expected. A lot of obvious anomalies, a lot of obvious dental features were overlooked, misnamed, or incorrectly recorded. So findings such as midline diastema, crowding, axillary cusp transposition, they were only mentioned by a minority of the dentists that took part with the survey. But in section 3, the results were quite satisfactory, it was quite promising, because they did realize that recording every single dental anomaly did help in identifying someone. They understood the importance, but they never put it to practice. So this is why I put the dental charting task as well, because if you ask a participant if you'll do a certain thing or not, they're definitely going to say yes. But the dental charting task was an exercise for them to actually show if they put that into practice or not. And in section 3 and section 4 as well, it was quite satisfactory to see that they understand how forensic odontology works and how maintenance of dental record was important in forensic odontology. And it was also good to see that majority of the participants maintained dental records as well. Now, to understand this a bit further, we're going to look at a case, an autopsy that I did in 2019. So this is from a DK body, and the lower jaw was completely non-integuous. The jaw had 4 teeth. So basically, this person's oral cavity had 4 teeth, and that's what you're seeing in the image. But we had to work with just 4 teeth. Now, from the AM data of missing persons list, this is an image taken in 1995, and this is definitely an AM data for us. Now, I want all of you to focus on the rotated premolar, 2-4, which is distally rotated. And I want to tell you, it was this single anomaly, this single feature, along with x-rays, of course, and other findings, that helped in identifying this particular person. So from this case alone, you can understand how every single feature in a person's oral cavity can help in identification if they're recorded properly in the AM data. And this is why I said this session is quite important for general dentists as well, and not just dentists, anyone who does charting. So it could be dental nurses, assistants, hygienists, dental students. So any recording that you do in the dental chart is going to be important, directly or indirectly affecting a forensic odontologist's work. Now, to understand this even further, I'm going to take an example from the dental charting task. So I'm going to take 2-5, which had an accessory cusp. And I created a scale of forensic significance of dental features. So that is starting from incorrect, partially correct, and so for the participants that said accessory cusp, which is an accurate answer, this is great because this is going to help me in my positive identification. But I also had answers such as talons cusp or sound tooth. Now, these are minor inconsistencies that I can explain in my autopsy report. So I can say it could be a possible dental charting error. Maybe the dentist did mean an accessory cusp because talons cusp is definitely an accessory cusp. So that could be the reason why this person misnamed it. But I also had answers such as torodont. And now this is an incorrect answer, and this is definitely going to throw me off of my autopsy process. And this is why the accurate answers have high forensic significance, because they're definitely going to help me with the right identification. The partially correct answers, well, they have moderate forensic significance, and they're okay as long as they're minor errors that are explainable inconsistencies. So they're not going to throw me off of my autopsy process. I will still be in the right path, but I can explain these inconsistencies. But coming to incorrect answers, this is definitely going to lead me to come to a conclusion called exclusion. For example, I might have Mr. X in my autopsy table, but I'm going to come with the conclusion, oh no, this is not Mr. X. While it's probably Mr. X's family who's waiting outside to see if it's their father, husband, friend, son who's on the autopsy table. And this is one of the reasons why I really believe that this thing, so forensic odontology itself, is a matter of life. So basically identifying someone, and that's the least you could do for his or her or their loved ones. Now, because there was this very poor performance when it came to created atlas, which is called the, and it is definitely for dental students and dentists, of course, but as I said, it could help other dental professionals as well, such as hygienists, assistants, and nurses. It does not only create an awareness on dental anomalies, but it also is a reminder of terminologies for the practitioners who tend to misname anomalies as well. Now, going to the atlas, so this is a PDF version of the atlas. It can be printed, and there's a QR code which will take you to the PDF version as well. To show you the digital atlas itself, so if you go to www.the, scroll down, you see this image. So you can use the atlas any way you like. So if you look at an image and you think, oh, this is something that I saw in a patient, you can click on that. There'll be a small description how the anomaly will look like. It's something that, it's a terminology that you're looking for, say dens invaginatus or something of that sort. Then you can go to the terminology and it would do the same, and it would show how the anomaly would look like. You also have positional anomalies, like midline diastema and crowding. I've also put pulp anomalies as well, such as pulp sclerosis and stones. As I said, the site also offers the PDF version, which you can download from there. If you scroll down, you can see the team that created the atlas. That's myself, my supervisor, Dr. Sheila Manika. We also had a medical artist help us with the dental atlas as well. There is also all of our email IDs that you can contact us on. And there's also a Let's Chat box. So if you have any queries based on dental anomalies, you can put it there and it'll be directed to me. So that's the digital atlas. Going back to the presentation. So to conclude, it was definitely seen that teeth is considered to be one of the easiest reliable method of identification, but it's still not used up to its potential in several countries. And the awareness on forensic odontology is still quite promising. It's still satisfactory among dentists, but the whole idea of using dental anomalies to identify someone was still poor. And again, with the case that I shared, we saw that every single feature or anomaly in a person's oral cavity can be used for identification if they're recorded properly in the AM data by that particular dentist. And of course, we saw the Atlas of Dental Anomalies and the scale of forensic significance of dental features. These were created to design, and they were created to aid the whole dental charting process by any dental professional. And I'm hoping that this would help in creating better, reliable, and up-to-date dental reports in the future worldwide. And that's me. And that's the paper that I published last year. So if you want to read more about dental anomalies, you can go to Forensic Science International Reports, and my paper will be there. That's me, and that's my Instagram page. And as I said, it's a private account, but you can definitely reach out to me on that. And that's also my email address. And that's me, and I'm happy to take questions. Thank you for your time.
Okay, so we do have a couple of questions. So for our first question is, what would shadowing a forensic dentist entail? What are some things we'd be able to learn?
Shadowing a forensic dentist, again, if it's for a whole month, because our schedule differs from one day to day. So we don't have an autopsy every day, or we don't have an age estimation every day. It depends on how the police calls us or the mortuary itself calls us and tells, okay, there is an autopsy. But if you shadow someone for at least a month or so, you're definitely going to see how a proper autopsy is done. And you'll definitely have age estimation cases. I'm not quite sure about bite marks because we rarely get bite mark cases, but you'll definitely have softwares which uses bite marks, and I'm sure if you ask the forensic odontologist, they're definitely going to show how it works, and you can use the software tool and all of that. But autopsy is definitely something that you will learn how to do, and is probably one of the most interesting parts of shadowing a forensic dentist as well.
Our next question is, who do you technically work for as a forensic dentist, the law or private practice or someone else?
So it can be, so if you're into research and teaching, you're definitely going to be working for a university. But if you're going to be a dentist who practices, but you're also a forensic odontologist, so you'll have your private practice, but you're going to be working, at least in my case, we're going to be working under the police. So it's the law. So even after we give our conclusions and write our reports, everything after that is taken up by the police. But you also work for the court. As I said, if you work as a forensic expert witness, you go as an expert witness and you submit your findings to the court. So sometimes you work for the court as well. So it depends on what you actually want to do. And it differs from one forensic odontologist to another.
Okay, and so our next question is, how can we involve ourselves in forensic dentistry while in dental school?
Again, I'm not quite sure how the dentistry program is in the US, but I know for a fact, at least in India or the UK, we don't have any courses or anything in particular that teaches forensic dentistry. But what you can do as a student is definitely read a lot about it, reach out to forensic dentists. There are pages and there are so many research articles as well. So you definitely do a lot of reading. I know hopefully in India in the future, they're going to include forensic dentistry as one of the specialties, one of the clinical specialties as well. So a lot of countries are doing their best to include forensic dentistry as one of the clinical practices, even in undergrad programs. Hopefully we get there.
And so our next question is, what job growth possibilities are there as a forensic dentist?
Again, it depends on what you want to do. So if you're into research and teaching, you can apply for universities, start with a PhD, get into research. You can even be program coordinators for certain universities that do not have forensic odontology. And you can even start your own department. But it's also, you can work for the police, as I said. But again, if you're trying to balance between your dental practice and then do forensic odontology as well, then that is when you would just work for the police and go back to your dental practice. But even now, forensic odontology is mostly a research subject. So it would be mostly working in research, and that's most of your job. But again, as I said, the morgue is going to call you, the police officers are going to call you, so you'll definitely have a lot of hands-on experience as well.
Okay, and so the next question is, how do you deal with stress or manage work and life balance?
Wow, so again, this is a very personal thing. I think it works differently for different people. Something very personal to share is I do struggle with anxiety, and I really was concerned with taking forensic odontology as my specialization, considering it's very stressful and there's a lot of negativity surrounding you most of the time because it's death and decay and all of that. So what works for me is distraction, and a lot of it. So I tend to, if I feel like I'm going to spiral into, oh gosh, I'm going to be anxious about this particular autopsy or this particular conference, what I do the most is reading, listening to music, something that works for me personally, and it can be different for one person to another. This, again, is a very personal, individual thing, but I handle my stress and I handle my anxiety hugely with distraction. I always wanted to get therapy, but this is a very bad thing to say, but I just couldn't find the time. I should. But yes, distraction helps a lot for me, a lot. So that's how I try to disconnect between my work life and my personal, private life.
Okay, and for the next question is, what is something you struggled with in dental school?
In dental school, wow. I can't think of something. It was definitely the clinical part of it. So when you start your theory subjects and then you do your preclinicals and you're okay. But when you transition to actual patients, the whole anxiety involved in, oh, I'm going to take a live patient, I shouldn't hurt that person, is something that I struggled with personally because I think I had anxiety. But clinically, I think I was quite happy with my handwork and it came naturally to me. I've also had a particular lecturer quite surprised because I had good handwork somehow. So I don't know if I personally struggled with something, but if it was a particular subject that I struggled with, it wasn't even a dental subject, it was pharmacology because of all the terms when it came to learning. But I think clinically I was okay, at least I was satisfied with, there was a lot to learn, of course. But I don't know if I particularly struggled a lot with anything. I'm sorry.
That's all good. That's all good. So for the next question is, were there any dental techniques or procedures you needed for your job that you didn't learn in dental school?
Oh, all of forensic odontology I didn't learn in dental school. It was only through my master's because, as I told you, back in India, forensic odontology was one chapter under oral pathology. Yeah, it was just one small chapter in oral pathology, and it vaguely mentioned anything about forensic odontology. It definitely said, okay, there is law, there is justice, you do this, and there are bite marks and everything, but it didn't give you any sort of, so any info that I know about my job right now is definitely not from my undergrad dental school. But as I said, of course, the charting, the incisions and everything definitely came from oral surgery and oral medicine and oral biology and all of that. But everything I know about forensic odontology is from my specialization. It's not like other clinical subjects where you learn a little of prosto, a little of endo. It's definitely not like that. Everything that I learned about forensic odontology was from my specialization, unfortunately.
And the next question is, how would you find a job as a new graduate?
New graduate from dental school or as a forensic dentist?
I'm assuming a forensic dentist.
As a forensic dentist, I'm sorry, I sound repetitive. It just depends on what you want to do. So if you want to be in research, you can apply for job opportunities, you can apply for your PhDs, you can apply for teaching positions in universities in whatever country you're in. If you want to just do autopsies and clinical practices, you can apply for positions in your local mortuaries with even amongst police. So in police association, there are forensic practitioners. So there's forensic pathologists, radiologists, odontologists. So there can be positions open within police associations as well. So that is something you can do. Also, even in law firms. So you'll have, as an expert witness, you can work as an expert witness. So you can apply for positions like that as well. I personally enjoy research and doing autopsies and all of that. So I do a mix of PhD, that is my university in teaching, and also working with the police. So it's a mix of both for me.
Okay, that's very good. So for our next question is, if not for forensic dentistry, is there any other specialty you would be interested in?
I think oral and maxillofacial surgery is something that I'm really interested in. Yeah, but I don't know. If I weigh between forensics and oral maxillofacial surgery, it's definitely forensics. But if not for forensics, it's definitely surgery, maxillofacial surgery.
That's really cool. And now we have our last question. Is there something you wish you'd done differently in dental school?
I think spend more time researching outside what is taught in dental school. Mainly because there's so many, like, of course we learn a lot from dental school. Don't want to sound ungrateful. There's so much you can learn from dental school. But as I said, when I graduated dental school, I did not have a proper idea about forensic odontology. So there's so many new things that are not in the undergrad program these days. So there's forensic dentistry, there's teledentistry, there's digital dentistry, there is AI in dentistry, so many interesting things that are shaping dentistry's future. So what I wish I would have done is read more outside of my books or my journals or anything that's taught in dental school. I wish I did that. Yeah, that should be it.
And that is it for questions. Thank you, Dr. Jayapriya, for taking the time to talk to us about your profession. It is truly appreciated, and I know I learned a lot from your presentation. And to our viewers, our quiz is linked in our link tree and in the description of this video as well. The quiz will stay open for 24 hours, after which it will close and scores will be sent out. A 3 out of 5 is required to receive credit for our session. And to Dr. Jayapriya, I want to thank you once again for today. Everyone have a great rest of the day.
Thank you so much. Take care.